Hi, I'm Evan Cohn. I'm a urologist at Fairfield Medical Center. Prostate cancer is one of the most common malignancies among men. It is something that is very diagnosable, very treatable, and it's something that if you're listening to this and you're over 50, or if you have a family history and you're 40 or over, you should probably talk to your primary care physician or a urologist. There are people that are more likely to experience prostate cancer: African American men, Scandinavian men, and men with a family history and a first or second degree relative. The most common symptom of prostate cancer is no symptoms. It's something that is pretty much exclusively picked up by the blood test, the PSA, and a digital rectal exam. If you're having symptoms, voiding symptoms or other things, those are probably not prostate cancer. And if it's stopping you from seeing a urologist because you're afraid of what those symptoms mean, don't. Come on in and we can probably take care of them. Symptoms that are bothersome to you: getting up at night more than once, a slowing of the urinary stream, a sense of not emptying your bladder out the whole way, a sense of having to get to the bathroom more quickly than you feel is normal, blood in the urine, burning with urination. Those are all things that would be something that would prompt a visit to a urologist. I've been in practice for 23 years at this point, and the way that we approach prostate cancer really is markedly different now than it was 20 years ago. Just because you have prostate cancer doesn't necessarily mean that you need to do anything about it. It can be followed. However, it's very important that you do follow through with what's called active surveillance, meaning you aren't diagnosed with prostate cancer and just decide, oh, that's great, and fall off the face of the earth. It's something where you need to be followed. And we're all happy to do that. There are times when prostate cancer does need to be treated, and it can be treated surgically, it can be treated with radiation. There are a variety of medications that can be given to treat prostate cancer, and these are all things that occur at different points in the course of prostate cancer. So I would say the most important thing to do is to follow up with your urologist and make sure that you're doing everything and understand all the options that are presented to you. There's a big difference between what we used to do and what's done now. PSA, this blood test, which is simple, it's very easy to do, it's something that can be done at really any lab, it's repeatable, it's reliable, and it's something that gives you good information not only to determine whether you should look for prostate cancer, but if you have prostate cancer, it gives a very good way to follow prostate cancer to see what's going on with it. So screening is a lot different than treatment, and I think people need to know that. Just because you look for prostate cancer, and even if you find it, doesn't necessarily mean you're compelled to do anything other than watch. Now, there may be a patient population in whom prostate cancer is diagnosed that it makes very good sense to do something to treat it. People over 50 routinely should be screened. People over 40 or people with a family history or other risk factors for prostate cancer should probably be screened starting at that age. We typically say if it's good for your heart, it's good for your prostate. Clean living, that kind of stuff is generally something to do. But really, there's nothing specific that we would say, oh, you have to take this food or this supplement. Really, it's all common sense stuff. So just come in and we'll take a look and answer any questions you may have.